I would say that the first, um, I would say, surprise in our finding was that low-grade stromal sarcoma, that is a relatively indolent type of cancer. And when I say relatively indolent, means that if you're able to remove completely the disease, you're going to be able to cure this patient. But the point is that quite often we are not able to do that. In the low-grade stromal sarcoma patient, usually what we are expecting is a recurrence that usually take place years after the initial surgery and treatment. And this is because they're relatively slow-growing entity. And therefore, again, it may take really years. And that patient that they came back after 30 years with a recurrent disease, okay? But the point is that with the low-grade stromal sarcoma, slow-growing tumor, and usually are hormone sensitive, and therefore we have tools, right, to try to target this tumor using aromatase inhibitor, progestational agent, and so on. What we didn't know is that the high-grade stromal sarcoma are really completely different entity from a genetic point of view. Because the initial idea was that there could be a progression, right, from the low grade to the high grade. And in reality, the genetic profile that we have seen in these two patients are completely different. So these are really two different entities, even if they start in the stromal cell of the uterus, and and potentially they may resemble to each other, but genetically speaking, they are different. And in term of clinical behavior, of course, they are also extremely different because the high-grade stromal sarcoma um, are aggressive tumor, usually minimally responsive to chemotherapy, unfortunately, that are very difficult to treat. So our analysis, our comprehensive genetic analysis that include, as I mentioned before, whole exome, whole genome, and RNA-seq, has been able to identify different subset of high-grade stromal sarcoma that may potentially be treated with targeted agents that are currently available. For instance, we found that about 8% of these high-grade stromal sarcoma, they harbor genetic characteristic of hyper or ultra mutation. What does it mean? It means that when we look to the number of mutation in total or number of mutation per megabase in this, in the genome of this tumor, we found a very high number of mutation. And this is usually related to mutation either in a gene that is called DNA polymerase epsilon, that is a gene endowed with proofreading capability at the time of DNA duplication, or in mismatch repair gene that are also genes that are able to repair the DNA when, again, they proofread the sequence, they identify a mutation, and therefore they're able to repair that mutation. But when the tumor acquire an alteration in one of these genes, usually become haplo-insufficient. So half of again, of this gene present in our cell is not able to work anymore, and this tumor acquire a large number of mutation. But because of that, they may be exquisitely sensitive to immunotherapy, in particular in the form of immune checkpoint inhibitor, such as, again, pembrolizumab, dostarlimab, and so on. So this is the first important thing. Even if it's less than 10%, it's always useful to sequence this tumor, because even if it's 1 out of 10, 1 out of 15, they have this specific characteristic, they could really respond very well clinically with the use of immune checkpoint inhibitor.